think we'll get started. We know that people tend to join sometimes a little late because of their busy schedules. So first of all, I wanted to welcome everyone to joining our discussion today. We have three distinguished guests, and I know that you will very much enjoy listening to them. So as you may have noticed, as an attendee, you are muted, and we need to do this because sometimes when there are multiple cell phones and phones, etc., we get quite a bit of cross static. If you have questions during this presentation, please send them to us in the question box, and then not in the chat box. And then what we're going to do is first we're going to have all the presentations, and then we'll take the questions. So as I mentioned, I am just delighted. I'm Elizabeth Goldblatt. I'm the Interim Executive Director of the Academic Collaborative for Integrative Health. And I am really delighted that we're going to have this presentation now on the Global Forum on Innovation in Health Professional Education. And we've been a member of this Global Forum since its inception, which it's been going now for 5 years. So the first person that will present is Patricia Cuff, who's a Senior Program Officer. She's on the Board of Global Health and Medicine Division. She'll present an overview of what is going on in the forum, and especially in terms of our work on health and well-being in reference to the workforce. It's wonderful having Patricia involved as she is our senior staff person and also has a strong background in nutrition. And as many of you know, we now have an organizational member that's from that area. The second person that will present will be Sandeep Kishore. Commonly we call him Sunny, and he is an Associate Director of the Arnold Institute for Global Health, an Assistant Professor in the Department of Medicine and the Department of Health System Design and Global Health at the Icahn School of Medicine at Mount Sinai. And these individuals can also add to their this very brief bio if they so choose. And then I'm also really delighted to introduce to you, and you all know her, she's on our Council of Advisors, is Mary Jo Kreitzer. She's the Director of the Center for Spirituality and Healing, a long-time colleague of the collaborative. She's a professor of nursing at the University of Minnesota. I think that she's also been involved in the National Center for Integrated Primary Healthcare on our University of Arizona project. And I know many of you have met Mary Jo at a number of our meetings. So the main thing I wanted to just briefly start out with is that the reason we joined this global forum, because it's quite a substantial time and financial commitment, is that virtually every health profession comes to these meetings, and the meetings consist of representatives from all national organizations. And so we have a wonderful opportunity to both educate the individuals that are there and also to really strongly advocate for disease prevention and for health and well-being. And that's really been our mission there. And in many ways, it's been, as you'll see over this next hour, highly successful. So on that note, I want to turn the mic now over to Patricia Cuff, the Senior Program Officer for the Global Forum.
Thanks so much, Liza. And I'm the director, as Liza mentioned, of the Global Forum on Innovation in Health Professional Education. You can see me up on the screen now, even though my lips aren't moving. You can just kind of imagine. This webinar is really designed to give you an update on the work of the Global Forum. And just so you know the orientation, you may be familiar with the Institute of Medicine, or IOM. So about a year ago that we had a restructuring. And so it's now an expanded organization that includes academies from science and engineering. So we now call ourselves the National Academies of Sciences, Engineering, and Medicine. So collectively we're called the academies. So that's where the forum is actually embedded. Now, what I'll be discussing today, I'll be covering the top 3 bullets there on your screen before handing the microphone over to Liza, who, as you just heard, is a very active member of the forum. And just to sort of go through how the structure of the presentations will be today, Liza will describe a specific, one of our working groups. We have a couple of them going on, but she'll be describing one of the working groups of the forum that focuses on the health and well-being of the workforce itself. You know, really, so often the healthcare providers are so concerned about really the health and well-being of the people that they care for that they often forget to care for themselves. And I think that the orientation of this working group is to really focus in on, you know, who's taking care of the caretakers, because that's who's really going to assist the patients as well as their own health and well-being within themselves. So this work group is being led by Liza, as well as our third speaker, who is Sandeep Kishore. And after Liza describes the group, Sandeep will then talk about two related efforts that stem from the work of the group. And one looks specifically at the cultural challenges within medicine and medical education that's believed to be linked to suicide among doctors and their trainees. So he'll describe some of the work that the work group is doing in that area that he's taken the lead on, as well as the second effort that looks at stress and burnout really among all the health professions, and how a multifaceted systems approach might be one of the ways of addressing these challenges. So then our fourth and final speaker will be Mary Jo Kreitzer. And Mary Jo will lead us through the background for an upcoming forum-hosted workshop. And this workshop will take a systems approach to looking at alleviating the work-induced stress and improving health, well-being, and resilience of health professionals within, but yet beyond, education. And just so you know, Mary Jo is actually co-chairing this workshop. And the idea for this workshop came from the breakout group that is being led by Sandeep and Liza, and draws heavily from the paper that Sandeep will be describing on the webinar today. So as you can see, it's all sort of intertwined, but I just wanted to give you that layout of what you'll be hearing about today. So who are we, and kind of where did we come from? The origins of the Global Forum stem back to 2010, when two medical doctors from Harvard, Julio Frank and Lincoln Chen, led a group of commissioners in updating the Flexner Report. As you remember, that set up the system of medical education roughly 100 years ago, written by Flexner. And what they did was they wrote a report that really took that thinking into the 21st century. And what they came up with was a report that was titled Education of Health Professionals for the 21st Century. Now, as you can see from the vision statement that I have up on the screen now, the commissioners had a much more forward-looking view than the Flexner Report. The Flexner Report was very biomedically oriented and really only addressed education from a medical perspective, from medicine. Now, you can see in their vision, the commissioners mention all the health professions in all countries, again, being much broader in their thinking, being patient and population-centered, and looking at health systems as opposed to the biomedical model, looking at the health systems in which the health professions work, and then being globally oriented and globally connected. Now, as futuristic and a vision as this is, I would actually argue that they really didn't go far enough. And I know actually one of the commissioners would actually agree with me because she co-chairs my forum. She was one of the commissioners on the Lancet report, so she has an inside view. But let me give you an example of what I mean. So the commissioners, when they did their work to write up the report, they drew from three professions: medicine, nursing, and public health. And while I think that certainly was forward-looking, the forum has now 19 different professions represented. So I think we have a much wider view of the full health system. Their vision looks at, as they say, they look at patients. Now, when thinking of the patients, it tends to leave out the health and well-being sort of all people, the population, and the health providers themselves. Now, in the last section, talking about teams, that tends to have a real clinical orientation, which then leaves out other forms of collaborations that could be much broader, possibly collaborating with communities or community members, or collaborating with other sectors, which becomes critically important when you're addressing things like the social determinants of health. But right in the middle of the report, the commissioners call for a group to further the messages that they set up, the messages of the report, and to take those messages and build upon them, and to think more into the future. So in some ways, I think that they recognize that they had limited funds and limited time, and another group should really take the message and run with it. And that's really, that next group is actually our forum. So we had our first meeting in January of 2012, and this report was released in 2010. So we, as you'll see as we move forward, how our work really drew from the ideas that originated in the Lancet Commission, but actually has taken it a bit further, given that we have the luxury of time and we're able to create a more diverse group. So as I mentioned, we are diverse. We are the largest convening activity here at the academies. We have forums and roundtables, but we are the largest of them all. We have 19 different professions. We have representation from 10 developed and developing countries. We have 2 co-chairs. One is Malcolm Cox, who is the former Chief Academic Affiliations Officer at the VA, and he's able to draw upon his experiences in an integrated health system to really help us look at some of the more controversial issues within the health professions. We also have representation from anthropology in Susan Scrimshaw, our other co-chair, and she is the president of Sage Colleges in New York. We have 44 member sponsors, primarily from health professional and academic associations, although we do have some foundation and some government support. As you can see, this is a listing of our forum sponsors, and I think it's important to have an acronym that has a lot of A's in it. And the Academic Collaborative for Integrative Health makes its way to the very top of the list, so I applaud you. So moving on, who are we? So I'd mentioned that we're global. This is important to us. We really encourage a bi-directional learning process across the professions, across sectors, and across national boundaries. And this picture that you see on your screen right now is one of our workshops that we had that we were looking at interprofessional education. And if you can see behind the table, there are 3. They're actually students. They're in residencies, and I think one is psychiatry, one is pharmacy, and the other is nursing. And they were going through an interprofessional education. And what they were doing was having a dialogue with colleagues who are in Uganda, who are also students, going through an interprofessional education oriented work. So they had an opportunity to dialogue with each other at our workshop to really show that it is a very global thinking forum. And every one of the topics that we take on, we make certain that we have a global perspective in the follow-through of the topic. So what do we do? Up top, you see our mission statement, and that we can use in our proposals. But what I really want to key in on is not so much the mission of the forum as the strategic vision that the co-chairs came to after speaking with many and hearing from many of the members of the forum. And where they began was breaking down professional silos. One of the things that they recognized was that each one of the professions comes to the meetings, and they have their own sort of silo that they work in. And the idea of breaking down the professional silos to try and reach each other seemed like the right direction to go in. But after living that for about a year, they decided to update the strategic vision and not just break down the silos, but actually build bridges across the health professions. And again, not just stopping at the health professions, but actually moving to build bridges across other sectors. So these are the topics that the forum has explored. And these topics were selected by the members themselves in consultation with their sponsoring organizations. And one of the things I want to point out is that it really reflects the maturity and the evolution of the forum. And I'll give you an example. So the first workshop we did, is, as you saw on the global screen that I showed previously, we started with interprofessional education and asking, what is interprofessional education? And as you can see as we move down the list, what we start doing is not just talking about what is interprofessionalism, but really moving towards applying the concepts of interprofessionalism into various topics, as well as starting this cross-sector dialogue and incorporating it into all of our work, with the ultimate goal of, I think, the greatest cross-sector dialogue needs to come within addressing the social determinants of health. And that really requires a very cross-sector dialogue in order to address the issues that are of importance in that area. So one of the, in my last slide, what I want to do is not just point out what we do, but I think the important thing about the forum is how we do it. We've mentioned many times that we're very interprofessional. We have global perspectives. We also try to take a very balanced view of any activity that we do, whether they're discussion papers or if they're workshop planning committees. We try to draw upon a variety of professions, not just have one profession come in and run the whole workshop, but to try and hear from a variety of voices. We try to be balanced for ethnicity, geographic location, as well as individual biases. We're always trying to balance. If someone feels strongly in one direction, we try to bring someone in that feels strongly in the opposite direction so that we can kind of come to a meeting of the minds somewhere in the middle. But I think most importantly about the work that we do at the forum is that we have a very flat hierarchy. So although we've got many, and I would venture to say, powerful organizations at the table, everybody has the same power as everybody else. Nobody gets extra votes. Nobody has extra time. It really is a flat hierarchy for everybody working together to try and accomplish the goals that we're setting out to do. So now what I want to do is hand the microphone back to Liza. And what you'll be hearing from Liza, as I mentioned before, is an activity of the forum that really attempts to implement some of these general principles that I laid out. And I just have to say that what she's going to be talking about, it really started with just, from what I saw, and Liza may correct me, but started with really two people and one vision that has really grown into something much more. And so with that, I'll ask Liza to take it from here. Liza? Liza, are you on the line?
Sorry, I am so trained to mute myself on these. Can you hear me now?
We can hear you now. Thanks, Liza.
Excellent. Sorry about that. You can go to the next slide, please, Patricia.
Liza, can I just, this is Beth, we did have a question. Someone can't see the display, so I just wanted to make sure that people can see it.
Okay. Renee usually works with those issues, so I'll let her take care of this. So
thank you.
The one thing I wanted to mention, thanks, Beth. The one thing I wanted to mention was that after we meet twice a year, and after we have our meetings, the IOM actually creates the publications, and these are available either, sorry, I use the IOM again, the Global Forum. The Global Forum has all the publications on the website, and they're also on our website, the collaborative website, and if you go under resources and under other publications, we will link you directly to the Global Forum website. So I think I mentioned back at our introductions, and I'll say it again very briefly, is that when John and I joined the Global Forum, we really went in with the twofold approach, which is one, educating people about all of our disciplines, and then also really going in with a focus on disease prevention, health, and well-being. And this was discussed at our board's level, because it is one of the areas that we feel so many of our disciplines can contribute quite so significantly. And the thing that we noticed right away when we joined the Global Forum is on a very informal, casual way, many people were coming up and talking to us about our various disciplines. And so from the start, we started bringing up these issues, both in casual conversations as well as to the forum members as a whole. And we gave them all copies of our CEDR, which, as many of you know, was a text about our disciplines, etc. So it started out informally, but then several of you know that Sarita Verma is on our Council of Advisors. Sandeep and I started talking almost right at the beginning. And so there were several people there very interested in this issue. And then what we noticed is that this just kept continuing over the years, and we finally created, we said maybe we should have a breakout group on this, and so we did create that. It's a second one here. So we did a stress, and we called it the Stress and Burnout Working Group. So we started out from, we were thinking of a more positive title for it, but the reality was we were seeing this amongst so many healthcare professions. So we decided to invite in, again, another one of our wonderful council advisors, Mary Jo Kreitzer. She has such a long history in this area of really encouraging health and well-being that we invited her in to speak to the entire Global Forum. And we also had a breakout session, and that went exceedingly well. Next, please. Oh, next slide, if you can do that, Patricia. Thank you. See, there we go. So coincidentally, I'm sure many of you remember seeing the national articles of how so many residents were committing suicide. And I vividly remember receiving a phone call from Sunny, you know, quite concerned about this issue and that we really needed to do something about it. It was just catapulted into national attention. So we had already had a working group going on it, but then that's when we really decided to start taking some action. And we started to both publish articles on this, that Sunny will be talking about it, but then we also began, John Weeks and I, John is my alternate at the Global Forum, started talking to Patricia, you know, what about an off-cycle workshop, you know, that really focuses on these areas, because it's really moving into a national situation that's causing great concern. So then the accreditors that come to these meetings had a tremendous interest in the area of how accreditation commissions might really begin reviewing their educational institutions and see how they are addressing this within the educational realm and preparing their students and faculty, you know, of how to begin working with this area in itself. Next one, please. I'm going quickly because I really want you to hear from our distinguished guests today more than myself. So as I mentioned, we first proposed an off-cycle workshop. John and I did, and we were delighted that the Global Forum was interested. Oh, and Sunny too, excuse me. Definitely Sunny has been very integral in pushing this element forward. And so we first proposed an off-cycle workshop. But one of the things we started noticing is while we were bringing up health and well-being from the very beginning, you know, of the Global Forum over 5 years, we were hearing it now more and more from presenters, by the Global Forum members, and it was just moving to a much higher priority. So we were extremely delighted when the Global Forum decided to do one of its main workshops when the Global Forum normally meets on health and well-being. Next one, please. So just briefly, it's a summary really of exactly what Patricia said. We started in 2014. We became involved because we were also, as many of you recall, we were involved at it was then called the IOM, the Summit for Integrative Medicine and the Health of the Public. It is very interprofessional, and as you know, the collaborative is an interprofessional organization. We really focus on health professionals and as much the educators. And again, as Patricia mentioned, we meet in person 2 times a year. And I know that Sunny now is going to be talking about the articles that we have worked on. And then Mary Jo will talk about the actual workshop that will be held in April of 2018. So once again, thank you everyone for joining us. So Sunny, I'm passing the mic to you.
Thank you. Thank you, Liza. So hi, everyone. I am Sandeep Kishore, based at the Icahn School of Medicine at Mount Sinai. And what I thought I would do is, if anyone is familiar with the community organizer, Marshall Gant, he helped kind of frame social movements and collaboratives over time across many disciplines. He has a framework for kind of inspiring and taking action. And it's basically telling a story of me, telling a story of us, and then a story of now. So I thought I just very briefly would tell the story of me and then move on to the story of us, and then talk about why this is important and urgent right now, and then hand off to Mary Jo. So as Patricia and Liza mentioned, I in some ways feel very privileged to be a part of this global forum, because I've been a member both as a medical student, so a trainee, as a graduate resident, so still a learner, but also involved in delivery, and now as a faculty member and so someone who works with medical students and nurses and social workers on the delivery side. And I have to say that, you know, this group has seen me go through kind of ebbs and flows of stress and well-being, and I honestly didn't have the tools or the knowledge or insights on what to do. So, you know, I, in some ways, went through very deep periods of burnout. And this forum, in many ways, gave me a platform, or at least something to hold on to. But more importantly, Patricia and Liza and Teresa and others have sort of supported my own wellness and well-being. And so I just also want to say how important the work that the collaborative is doing, and sort of situate that in the work of the Global Forum. And that's why I'm on the call today. So Patricia, next slide. So one of the thoughts that we had thinking about the story of us, so how do we take a story of students and learners, or even health professionals in practice, what they're going through, and situate that into a larger movement? So what is that us, and who do we mean by us? Is it just doctors? Is it just nurses? What I loved about this global forum, and I think it's why this is so important, is we realized early on that no profession will solve this alone. So stress and burnout and resilience is a team sport. And so early we realized that it's also not just the fault of an individual, that there is sort of two sides of the coin, where there's resilience and well-being for each person, but there's also a system that sort of drives some of that stress and burnout. So we started to put together a team drawn from these disciplines. So we had social work, nutrition, integrative health through Liza, psychology, medicine, nursing, and dentistry. And we surveyed about 252 respondents. So that's the great benefit of this forum, is you have a network where you can sort of crowd in insights and learnings. So 252 respondents from 25 different professions. And as many of you know, in the integrative health space, many times people can be fairly siloed. The doctors only care about what the physicians think, and the nurses and so on. So this is a truly transdisciplinary kind of interprofessional approach. And 90% of the respondents reported pretty deep stress. And so we realized that there was a systems approach that we needed to craft together to kind of address stress both within the health professions and, more importantly, right beyond it. I'm going to return to this, because this is in many ways the kind of foundation and the architecture for the meeting that Mary Jo will be co-chairing in the future. Part of this, we realized, though, that we were taking on a really big problem. I mean, it's really difficult, right, to think about, so Sunny or a learner, why are you stressed, or like, what's happening? And there's so many different responses, and so many different professions can kind of feed into it and be part of the problem, and also, most importantly, part of the solution. So we realized early that one strategy would be it's almost like an accordion. So we kind of expanded the accordion very wide to capture everything. And then we started to squeeze the accordion down. So Patricia, next slide. So here's just a kind of a frame on what how we started to think about the key points. So students, trainees, faculty, and health professionals all affirm that stress has a direct human toll on productivity, efficiency, quality, and the human capital of the workforce. Therefore, a strategic move is necessary to shift the paradigm and create a new normal, one that is life-affirming, health-oriented, and drives durable changes for the next generation. So then if you go on to the next slide. So here we had a key innovation in my view. So we had various disciplines put in their perspective on how they see the problem and what some of the actions and interventions could be. So we have the osteopathic profession. It was led by a learner along with some of her colleagues to situate burnout and depression and even suicide in the lifespan of her training. We had a psychology group put a deep focus on well-being and self-care in graduate students who study psychology, both, again, at the individual and at the systems level. We had a nutritionist and dietitian who found, I mean, it sort of surprised me that dietitians and nutritionists have some of the highest prevalence of eating disorders. And so she sort of talked about some of the poor eating habits that are secondary to stress and how dietetics could be both part of the problem and also part of the solution. We have the occupational therapists who were a key lead on thinking about mindfulness and self-care protocols. And then if you go to the next slide, this is something that I am sort of representing the profession of medicine, again, both as a learner and also as a faculty member, something I feel very strongly about. I'll spend a moment here. And that is, there is a huge stigma and a huge cultural barrier that I see when I think about sort of the story of us. And that is many people who are burnt out or stressed. I mean, just think about it. You don't really have the incentives to seek help. You don't really have the incentives to ever try to break that pattern. It's never normalized. Of course, there's stress and so forth. And so one of the things that we did was to try to actually write a perspective piece called Breaking the Culture of Silence, where we talked about how the group of physicians has some of the highest rates of suicide per capita. And Liza is completely right. When I was an intern, we had 3 suicides by trainees within a week. And I think what was so difficult about that for all of the trainees at the time is that everyone could understand it. So the fact that we all understood why a caretaker would take their life. And so how do we serve the server? How do we care for the caretaker became something that a lot of us felt viscerally. And so in this particular paper called Breaking the Culture of Silence, we responded to a suicide note by a third-year medical student named Catherine. And it was, we had a Catholic priest, a nurse, a chair of surgery, and myself as kind of a trainee perspective to basically showcase vulnerability and to sort of change the narrative. And suddenly we started to find that other luminaries in this field, including people that write exams for medical students, as many of you know, exams cause a lot of anxiety and stress in the health professions. And a member of the National Board of Medical Exams sort of wrote about his own experience to start to normalize it. We started to get residents who now suddenly felt comfortable saying, I felt alone, but I wasn't. Depression is rampant among doctors in training. So it's just sort of a movement in terms of the story of us to break that culture of silence. There's now other trainees and potentially other luminaries in the field who are starting to break that culture of silence. And so I will then end, if you go to the next slide, Patricia, with the story of now. And so this is basically based on the framework that was set out in that first paper that on sort of system stress and why it leads to the story of now and sort of the role of this group right now. We broke this up, and this is a very complex issue. So how do you even start to piece it apart, and what do you latch onto first? What do you prioritize? Basically, the way we see it is you have a microsystem, you have an organizational system, you have a peri-organizational system, and you have a system that's even around that. And some of the moderating factors there are things like culture. And so what we're trying to do with narrative is change that culture and get others to speak up. There's health and wellness. there's structural policies, there's the work environment, and then there's role models. And I just want to spend a moment on a set of 4 or 5 actions that kind of came out. At the top of the list was addressing organizational culture, which is a systems issue. So making well-being and resilience the norm, not the exception. Promoting health and wellness. Aligning supportive policies. This shows the importance of the sort of C-suite and some of the key decision makers and getting those financial drivers that we all know about to align with some of the things that actually drive health, not burnout or stress. Supporting students, trainees and professionals in the practice setting, people like myself 4 or 5 years ago. What if I didn't have Eliza? What if I didn't have a Patricia? You know, what would I have been? Would I have been another statistic? And creating and training positive role models that kind of influence, mentor, and shape. I can't underemphasize how important some of these individual and systems actions are. So that's a kind of just a teaser of some of the products that have come out, both at the sort of personal level, the us or we level, and most importantly, the urgency of now. And with that, I'll pass it on to Mary Jo, who can sort of close it and take us into the workshop. Thank you.
Well, thank you very much, Sunny, and good morning, good afternoon, depending on where you are, everyone. I want to really start by thanking and acknowledging the work that has really gone before me, and you know, John and Liza, certainly within the collaborative, and your leadership in the forum has been very instrumental, and it's been wonderful, Sunny and Patricia, to see the work that you've done getting us up to this point. Next slide, Patricia. So the workshop that's going to be hosted by the forum will be next April. So the dates are April 26th to 27th. And as we sort of look at this issue of stress, burnout, resiliency in the workforce, as Sunny described, you can kind of look at it from many different perspectives. And there's been much work that's been done at the individual perspective. How do we reduce people's experience of stress? How do we help them develop skills to better cope and better manage that stress and build positive resiliency and well-being? But I think there's also a concern that in addition to that individual work, we have to be saying what's happened in our cultures, in our systems, that so many people are getting stressed and burnout. So essentially, how do we go upriver to focus more on prevention? And so that's why in this workshop, it's even titled A Systems Approach to Alleviating Work-Induced Stress and Improving Health and Well-Being, because that's really distinctively the approach we want to take in this workshop. The workshop itself will be co-chaired by myself and a physician colleague, Zoe Talib. Next slide. Why it's important to address stress and burnout, I feel like has really been addressed by really Patricia and Liza and Sunny. But how we'll frame it in this workshop is that there are several perspectives of you know, why it's an economic argument, that stress and burnout diminishes our productivity. It leads to poor quality care. It's a workforce issue because as people become stressed and burned out, they're more likely to leave the profession of their choosing, and that has large ripple effects that are system-wide. It's a patient care issue because of the patient safety as well as quality, and we know that when health professionals are stressed and burned out, they're more prone to error, and they are also less empathetic, so it undoubtedly affects the patient experience. And it's also important to address this issue from just the standpoint of compassion to the caregivers, compassion to the healthcare providers. So that's the broad framing of the workshop. Next slide. So why is it important to address this issue from a global perspective? Clearly it is a global issue, and so while there's much of the literature that points to the crisis this has become in the United States within medicine, nursing, and the other professions, as we've talked to colleagues around the world, it is clearly a global issue. When I was at the World Congress of Integrative Medicine in Berlin, last week I was co-chairing with a colleague, a medical colleague from Brazil, who talked about in one of their medical school classes they had 6 or 8 students attempt suicide in that particular class alone. So it's a common experience that crosses borders, and the fact that we are living in a global world, we have a globalized workforce, and so it's important to address these issues from a workforce perspective. And we feel like there's enormous opportunity to learn across borders. And so I think one of the things that we really are excited about in this workshop is really learning from colleagues. Next slide. It's our intention to look at this issue from a standpoint of systems so that we really get at the root cause of stress. As I said at the beginning of my presentation, we really want to look at this from an upstream point of view, recognizing that if we don't ever address those root causes of stress, we're going to continue to have cultures that produce the outcome that we're trying to change. And that there are many stressors that really are outside the control of the individual. And so a systems approach, just like in the whole quality arena, where we want to not just blame the person, but look for system issues that cause errors in the system. We want to look at this whole issue of stress and burnout in the work environment from a systems issue and say, what is it within our cultures and what is it within our systems that are really producing these results. And so systems issues I think are important to look at not only in the practice environment, the clinical environment, but we're also interested in looking at systems issues that happen during the course of education. We know, for example, in a number of professions that empathy erodes during training. And so the longer somebody is in the pipeline to become a health professional, the less empathetic they become. So we're interested in looking at what are the kind of systems issues that cause that to be. So next slide. So whenever the National Academies of Medicine and a forum like the Global Forum takes on doing it an initiative, in this case the workshop, there always is a statement of task that's created, and then the statement of task actually has to be approved beyond just the Global Forum by the National Academies of Medicine, and so medicine, in science, engineering, and medicine. And so these are just some highlights from the statement of task that Patricia worked with the group in creating. That we'll be hosting a public workshop to look at system-level causes and downstream effects of job-related stress affecting all professions working in learning environments, both clinical and in the classroom. And it will be exploring how different professions cope with the stresses of educating health professionals under current health and educational structures, and how adjustments in policies and incentives might move organizations to adopt a more welcoming environment for testing and implementing individual stress reduction and resilience building strategies. Next slide. So some of the key questions that we will be addressing in the workshop is, what is the role of leadership? So what does leadership do in terms of creating a culture and impacting the culture? Are there financial incentives that could be introduced to allow education and health institutions the freedom to promote health and well-being among its faculty and providers? Are there leadership development initiatives that will be helpful in promoting self-care strategies? What sort of policy shifts might happen that could incentivize leaders of education and health institutions to want to make a culture shift and make positive organizational changes? And then finally, what might be some of the downstream impacts of these policy changes? Producing friendlier, more collaborative work environments. And as you can imagine, we believe that if you're actually doing this in the educational institution or doing this in the clinical environment, that ultimately it will improve not only patient care, but care team well-being. So We have our eye very much on what used to be described as the triple aim. How do we improve population health, reduce the cost of care, and improve the patient experience? And now, as many of you know, we've added a fourth aim to that. How do we improve care team well-being? So next slide. So a workshop planning committee has been convened that is very interdisciplinary. It includes 16 individuals who really have a background or expertise in cultural competency, community and public health, mental health and wellness, leadership development and systems, healthcare, global health, and interprofessional education and collaborative care. Next slide. And how we intend to do this work is it will be doing much more work up to the workshop, and it won't be just hosting a workshop. That during the time between now and when the workshop is held next April, we really plan to have a series of conversations to help tee up the content for the workshop. And so we've identified, in addition to the 16 members that are on the planning committee, a number of consultants that are advising the planning committee. For example, we really want to look at business and businesses that have created positive work environment. So what happens to create sort of a culture that's a healthy culture in that respect? We're really interested in human factor design. So if you look at human factors and systems design, what are some elements that could be in place that could help produce positive effects and impacts? So we have deep gratitude, not only, as I mentioned, to the early leaders of this effort, but we have 44 sponsors of the forum, and we also have received, for this workshop, support from the George Family Foundation. And so we'll be convening the first meeting of this work group probably around mid-June. And so those of you that are on the call today really have the earliest preview. This is really the first time we've even talked about this work publicly. So with that, I think I will close the presentation part of this call today, and we can move to questions or comments. And I believe, Patricia, you're going to moderate those.
Terrific. Thanks so much, Mary Jo, and thank you, Sunny and Liza. Those were fantastic presentations. If anybody has any questions that you want addressed, please write them into the question box, and we will take them as they come. But while we wait for that, I wonder if I could pose a couple of questions, and I'll put two of them out there now. One is to Mary Jo, and I'd be curious to hear, given your position as the director at the Center of Spirituality and Healing at the University of Minnesota, what in your background do you think that you might apply to the workshop, to the sort of the thinking and the development of the workshop? What might you draw from your background and your experience to apply to the planning for this workshop? And then another broader question, maybe this more goes towards Sunny and towards Liza. What would you, as forum members and having really probably the longest amount of time to think about this topic and the potential of the workshop, and probably you two have done the deepest dive of anyone, what would you like to see come out of the workshop? Like what do you envision would be either next steps or a goal or whatever the case might be, but what might you want to see come out of these continued efforts? So I don't know, Mary Jo, could we start with you as far as what
sure.
your background experience in applying to the workshop?
Sure. I would say, Patricia, that the Center for Spirituality and Healing at the university is 22 years old, and we were really established as an interprofessional, interdisciplinary education and research unit within the Academic Health Center. So I think I draw in all of the work that I do heavily on that multidisciplinary, interdisciplinary perspective. So I think I bring that perspective with me. From the beginning, the center has also been very interested in looking at not only traditional, conventional ways of approaching disease, but also really looking at prevention, health promotion, and looking at the importance of culture, spirituality, as well as integrated therapies and healing practices. So I think in all of my work, I take very much about holistic view. And then finally, I would say that for the last really 10 to 12 years, we've been doing a lot of both teaching and research in areas of stress reduction, mindfulness, well-being, and resiliency. So I have quite a bit of experience working in both interdisciplinary initiatives as well as within particular health professional schools. And increasingly that work focuses on how do you really create cultures of well-being. So those are some of the experiences I've had in my background that I'll be drawing upon.
Terrific. Thanks so much, Mary Jo. Sunny, I wonder if you might reflect upon what you'd like to see come out of these efforts.
Yeah, no, I think it's a brilliant question. I would say one product would be a toolkit or a checklist that you could hand to a CEO of a health system or a decision maker like a chief financial officer, someone that manages sort of the health workforce and human resources. Like what are the three things that we as a movement are kind of petitioning for in terms of priorities? I mean, it's 1,000 priorities, but what are the three things that must come out? I think if we could create a priority list of actions and the audience member being a CEO or a health system decision maker, that'd be what I'd be looking for. And the second thing would be a way to get scale by getting some of the young health professionals and some of the students and learners activated too. Because there's nothing like having a patient safety movement tag team with a health professional learner movement to really excite society to say, like, what are we really doing when providers are becoming patients themselves? Like, how is that appropriate for healthcare and for patients? So movement and a checklist.
So I can see from your response that the work of this of the subgroup will not end with the workshop. Those are lofty goals, but they will continue on. That will build upon the ideas that are set up in the workshop to try and accomplish some higher more structured efforts. So I think that that's fantastic. And we did receive a question: are there ways our organizations that are members of ACIH can prepare for this or participate? What I would encourage you to do is to turn to Liza. Liza is our liaison to the Global Forum, and she can work with you as far as some of the opportunities that may come up. We certainly will be doing some outreach, and I know that there will be opportunities for you to dialogue with the with some of the committee members. But most importantly, I think working with Liza to have your comments and your input represented at all of the planning meetings, I think will be very helpful and informative as well. And through Liza, we can talk about other ways that there's the potential of you being involved.
And Patricia, just to add to that,
sure,
sure. We have a task force now that consists of, I think, over 15 or 18 people that we actually do an email with and a conversation with before every Global Forum meeting. So whoever expressed that interest, please contact me. And so we consciously work with our larger membership on these issues, mostly on feedback. And as you're well aware, we are very careful on what we can circulate and what we can't circulate, because the Global Forum and the National Academy of Medicine, so sometimes how we time our circulation of information may vary. But the one thing I would like to add on, and I'll do it briefly because hopefully if there is another question, is that in the early years of the Global Forum, I remember having dialogues with John and other people as well, about the and Sunny about the economic drivers in our healthcare system and really querying of how much does that affect, the stress and the burnout, because I think we all know it's a contributing factor. And in the early years, it was just too soon. We really were focusing on interprofessional and team-based care, and it was a little bit of a sensitive subject, right? So what happened, though, over the years is, again, because it kept coming up and being catapulted into the national attention, the whole issues of the economics of it have really come into play. So I would agree with Sunny, in terms of what to come out of this workshop. I love the idea of a toolkit and resources. There are a lot of resources now out there for individuals. In fact, I've had individual healthcare professionals saying, I don't want to be told to take another mindfulness-based stress reduction course. The issue is really organizational. And I do think that the more we can have accreditation commissions and testing, certification, licensing boards attend this workshop and also very much listen to the students, it's often through the educational approach where we can really begin to make change. So I think who we get into the workshop will be very important. And I do like some level of information that we can disseminate, as well as, of course, continuing our working group. So thank you.
Terrific. Well, and on that note, I think that was a wonderful note to end on. I want to thank you all for joining the webinar. This has been a great opportunity for us to spread some of the messages forward of the work of the Global Forum. And I look forward to hearing your thoughts through Liza. If anyone has any additional questions, please feed them through Liza, and we'll be happy to respond. So thank you, everyone. Bye.
And the webinar will be on our website in about a week. Is that right, Renee? By the way, Renee handles all of our technology. She's our Director of Operations, and I want to thank Renee for all of the work she's done in helping prepare for this excellent webinar. So it'll be up on our website relatively soon. Thank you, everyone, and bye-bye.